Imagine you're lying in the dirt of a cold, damp cave. Your head is pounding. You're burning up, shivering uncontrollably, unable to move. There are no doctors, no medicine, no language to explain what's happening to your body. Just the sound of fire crackling and the quiet breath of others watching you suffer. What happens next might surprise you, because the story of sickness in the Stone Age isn't just about pain, it's about compassion, survival, and the moment we first became human. What did cavemen actually do when someone got sick? The truth is far more advanced and far more emotional than you think. Stay with this video, because what you're about to discover will change everything you thought you knew about our ancestors. In the damp darkness of a Paleolithic cave, the flickering firelight casts long shadows across rough stone walls. A man lies curled on the ground, his body racked by deep, hoarse coughing. His skin is clammy, his breath uneven. He doesn't understand what's happening to him, only that it hurts. Around him, a few figures crouch, watching silently. No one reaches for medicine, because there is none. No one calls for help, because there is no healer, no language for the internal chaos that is devouring him from the inside. There is only the sound of fire crackling and a quiet, helpless witness to suffering. This was illness before medicine, before language had a word for infection, before anyone could name a fever or understand inflammation. Pain was a raw, untamed force, a signal from within that something had gone terribly wrong. And for those who lived in a world where survival depended on every step, every breath, every decision, pain could mean the difference between life and disappearance. To us, pain is a symptom. To them, it was a mystery, a sudden aching joint, or if a sharp pain in the gut wasn't something you scheduled an appointment to diagnose. It was something you endured, feared, or ignored until you couldn't anymore. In the prehistoric world, illness wasn't compartmentalized as a medical problem. It was a total rupture in your connection to the group, to the hunt, to the flow of daily life. And when you were sick, you were vulnerable, not only to the forces inside your body, but to the dangers outside it. A fever might dull your senses, a wound might fester, a cough might give away your hiding spot. Every ailment, no matter how small, had consequences far beyond discomfort. What did they think when the body betrayed them? There were no microscopes, no knowledge of bacteria or viruses. There was no concept of an immune system or a bloodstream, but that didn't mean they were oblivious. Pain made itself known, loudly and consistently. It interrupted sleep, slowed movement, made food taste different, and forced others to take notice. The body became an untrustworthy vessel, heavy, unreliable, unpredictable. And without understanding its inner mechanics, early humans had only one way to respond: observation, reaction, and adaptation. Even without language as we know it, people were extraordinarily perceptive. They recognized patterns. They noticed when certain people avoided certain plants or animals and felt better. They saw how wounds healed or didn't. They witnessed the toll of harsh weather, hunger, injuries, and internal afflictions that came without visible cause. Illness wasn't invisible. Its signs were etched into posture, expression, behavior. Someone who once walked upright now hobbled. Someone who once sang now only moaned. And slowly, over time, even without science, ancient humans began to build a quiet, unspoken archive of symptoms and responses, what helped, what didn't, what to fear, what to accept. But pain did more than isolate. It also transformed relationships. When someone was injured or weak, the group faced a choice: abandon or adapt. And surprisingly, many did adapt. Skeletal remains show that people with broken bones, sometimes multiple fractures, lived long after their injuries. That means they were fed, protected, perhaps even carried. In a world with limited resources and constant danger, choosing to care for someone who could not contribute was not a trivial decision. It was an act of value, a recognition that even the unwell had meaning, presence, and a place among the living. Still, for many, illness marked the beginning of withdrawal from activity, from the hunt, from the flow of life. A sickness that lingered too long could mean disconnection. In a time when every hand mattered, being unable to help meant relying entirely on the grace of others. And grace wasn't always guaranteed. Some were left behind, some simply faded into the landscape. But many others, against all odds, found ways to endure. They didn't understand germ theory or inflammation, but they understood cause and effect. If someone got sick after drinking from a certain stream, that stream might be avoided. If a specific root made the body vomit, it might be remembered and feared. Through trial, error, and lived experience, a primitive but powerful body of knowledge emerged, not written in books, but carved into memory and shared through action. This wasn't medicine in the modern sense. There were no sterile tools or prescriptions, but it was something else: instinctual survival, shaped by necessity, woven into the daily rhythms of life. Illness wasn't treated in isolation. It was embedded in everything: how you ate, how you moved, how others responded to your struggle. And in this way, sickness was both deeply personal and unavoidably communal. It reminded the group of its limits, its vulnerabilities, and its strange, stubborn ability to keep going. To be ill in the Stone Age was to confront existence in its most raw and uncertain form. There was no safety net, no certainty of recovery. There was only the moment, the body, and the will to endure. And in that narrow space between agony and adaptation, something remarkable began to emerge. Not just survival, but something deeper. A recognition that to live together meant not only sharing food and shelter, but also pain. That even in the most unforgiving environments, the human instinct to care could shine through the darkness. There were no pharmacies tucked between the cliffs, no labeled bottles with instructions, no white-coated healers preparing remedies in stone huts. But the prehistoric world was not without medicine. It was surrounded by it, layered into the soil, hanging from the branches, sprouting between rocks, drifting on the wind. For early humans, nature was not just a backdrop to survival. It was a living, breathing apothecary waiting to be discovered one bite, one burn, one observation at a time. Long before chemistry and textbooks, the earth itself offered cures. But to recognize them required something far more ancient than science: instinct, curiosity, and the ability to watch and learn not only from each other, but from the animals who shared the land. It likely began with accidents. A child playing with roots chews on one and finds their headache easing. A hunter with a swollen leg presses cool mud against it and notices the relief. A woman with a stomachache drinks from a certain leaf-steeped stream and feels calmer by morning. None of it is planned, none of it is explained, but each tiny discovery embeds itself in memory, and soon patterns begin to form. This bark numbs the tongue, that flower makes you sleepy. These berries calm the stomach, while those bring nothing but misery. In a world where observation was survival, even the subtlest reactions became lessons etched in lived experience. Some of the earliest medicinal instincts may not have even come from humans themselves. In the wild, animals are quiet teachers. Chimpanzees, for instance, have been observed chewing bitter leaves not for nourishment, but to rid themselves of parasites. Birds line their nests with aromatic herbs to ward off insects. Wounded creatures seek out certain clays or lick salt-rich rocks to ease pain. Prehistoric humans, living closely alongside these animals and constantly watching them, would have noticed. And in the silent mimicry of survival, they may have copied them, testing the same plants, mimicking the same behaviors. The forest, the mountain, the savanna became both classroom and pharmacy. Every bite, every burn, every breath became a diagnostic tool. Over time, the most useful discoveries were likely remembered not through language, since early humans had only the simplest forms of communication, but through ritual, repetition, and association. A certain root might be chewed before long walks. A type of moss might always be pressed to bleeding wounds. A bitter tea made from bark might be drunk after meals. These weren't random habits. They were early prescriptions, passed down not as instructions, but as behaviors copied by the next generation. Medicine, in its oldest form, was movement, touch, taste, trial, and those who remembered what worked, who noticed what healed, became the quiet healers of their groups, not because they held authority, but because they held memory. Even the elements played a role. Fire wasn't just warmth, it was purification. Wounds cauterized with embers, water boiled to make it safer to drink, smoke used to chase insects or calm minds. Mud, rich with minerals, was smeared on stings or used to cover infected skin. Ashes, cooled and crushed, may have been used to scrub or soothe. None of it came from a medical theory. All of it came from experience, from noticing, or from trying. And while some experiments surely failed, perhaps with painful consequences, others succeeded just enough to stay. Perhaps the most remarkable part of this early relationship with nature is how much it relied on intuition. Without knowing why, people gravitated toward remedies that worked. The sharp taste of a willow bark, for instance, hinted at its salicylic acid, the same compound used in aspirin. Certain lichens and molds, now known to have antibiotic properties, may have been pressed into wounds simply because they seemed to stop them from worsening. The sweet sting of honey applied to cuts kept them from festering. None of these discoveries were theoretical. They were real, tangible, immediate, and often life-saving. But the use of nature was not just physical. Some plants altered the mind, inducing dreams, hallucinations, or calming frenzies. These experiences were often interpreted as spiritual or sacred, giving rise to rituals and beliefs that blurred the line between healing and the mystical. The forest wasn't just a place of food, it was a realm of power, danger, and transformation. To walk into it and return with a cure was not only practical, it was revered. The one who knew the plant that soothed the child's fever, who remembered the bark that calmed the pain in a cracked tooth, became more than just a survivor. They became a bridge between the raw chaos of the natural world and the fragile order of human life. This connection to nature wasn't a luxury, it was essential. Without it, injury meant infection, hunger meant poison, fear meant paralysis. But with it came possibility, relief, endurance, continuity. And while their understanding of illness was far from complete, prehistoric humans built a foundation of healing through contact, courage, and a quiet willingness to learn from the world around them. They had no shelves lined with medicine, no labels, no doses. But they had the forest, the riverbank, the stones, the sky, and in that vast, wordless world, they began to shape something that would echo across every culture, every era, every future discovery. The simple, astonishing truth that nature heals if you're brave enough to listen. When we imagine the past, we often think in images, shadows around a fire, hunters with spears, children splashing near rivers. But bones remember what the mind forgets. Long after the stories have faded and the names vanished, the body continues to speak. It speaks in fractures, in growths, in worn enamel and misshapen joints. And for archaeologists and anthropologists, it is these silent remains that tell the most human stories, stories of pain, endurance, trauma, and sometimes healing. A broken femur buried in sediment for thousands of years is not just a bone, it's a chapter. It tells us someone fell, or was hit, or twisted wrong during a hunt. But what truly captivates scientists is when that fracture has healed, because healing takes time, and time means survival. It means that person, injured and unable to walk or fend for themselves, was helped. They were fed, protected, perhaps even carried. In a world of predators, scarcity, and constant movement, the decision to care for someone who could not contribute meant something profound. It rewrites the image of prehistoric life not as brutish and selfish, but as layered with empathy and cooperation. Scientists read these bones like detectives read a crime scene. Using CT scans, X-rays, and microscopic analysis, they can see how a fracture set, how infection spread, how inflammation warped a joint. A jawbone riddled with abscesses speaks of a life lived with persistent tooth pain. Vertebrae fused together tell of chronic arthritis. Bones with spongy interiors suggest anemia. In some remains, tumors have been identified, signs of cancer, long before industrial pollution or processed food. These weren't anomalies, they were part of life. Disease did not wait for cities to flourish. It traveled with us, hid in our blood, clung to our DNA. One of the most revealing sources is the mouth. Teeth are time capsules. They don't just chew, they archive. Enamel, once formed, doesn't regenerate. So every stressor, from childhood malnutrition to fever-inducing illness, leaves a mark. Horizontal lines across teeth, called enamel hypoplasia, indicate times of severe physiological stress. Cavities reveal diets rich in starch or sugar, whether from wild fruits or later early farming. Worn-down molars show what was eaten and how. A chipped tooth might speak of an accidental blow, a habit of using teeth as tools, or even a fall during a chase. And every infection in the mouth or wrist spreading, without antibiotics, into the bloodstream. But bones don't just show us what hurt, they show us what lasted. The skeleton is a story of resilience. In one famous case, the remains of a Neanderthal man were found with a crushed foot and severe arthritis in the hip, yet he lived for years after the injuries. Another skeleton, showed a woman who survived trepanation, surgical removal of part of the skull, evidenced by new bone growth along the edges of the opening. These weren't primitive victims, they were survivors, and their bones prove it. Of course, not all wounds healed cleanly. Infections left jagged holes in skulls. Inflammatory diseases gnawed at spines. Parasitic infestations warped the growth of long bones. And in some cases, the skeletons of infants tell quiet, haunting tales of lives that ended too soon, likely due to fever, respiratory illness, or digestive infections that even modern medicine sometimes struggles to treat. The frequency of child remains with developmental abnormalities, bone thinning, or signs of starvation paints a picture of a world where survival was always on edge. Still, the deeper scientists dig, the more they uncover not just pain, but adaptation. Spinal deformities in adults suggest they learned to move differently, perhaps shifting their role in the group. Evidence of repetitive stress injuries shows that certain tasks were done over and over, kneeling, grinding, lifting, tasks that shaped the body and left echoes in the bone. Even where trauma is evident, it's often accompanied by signs of adjustment. Bones that fused around injuries, limbs that adapted to new angles, joints that bore more weight than intended. These are not stories of defeat, but of bodies bending, shifting, enduring. And then there are the subtle signs, less dramatic, but equally revealing. Calcified arteries in mummified remains hint at cardiovascular issues. Thickened skulls suggest chronic vitamin D deficiency. Spinal lesions point to tuberculosis. All of it proves one simple haunting truth. Our ancestors didn't live separate from disease. They lived through it, alongside it. Their struggles mirror ours more than we'd like to admit. And the farther we look back, the clearer it becomes that pain, illness, and the will to survive are not modern experiences. They are ancient companions. What's perhaps most moving is that these remains don't come with names or stories. We don't know who they loved, what they feared, what they dreamed, but we know they hurt. We know they kept going. And through the quiet testimony of bone, they whisper across time not only how they suffered, but how they endured. In a time when survival hinged on every able body, when a twisted ankle could mean the end of a hunt, and a cough could attract predators in the night, it seems almost irrational to imagine a group slowing down for someone who could no longer walk. And yet, the bones don't lie. Again and again, archaeologists have uncovered remains that defy the logic of pure survivalism. Bodies with severe disabilities, crushed limbs, fused joints, or degenerative conditions that lived not for days or weeks, but for years after their injuries. These weren't short reprieves. They were long, sustained lives made possible by others. In the brutal theater of prehistory, care was not an exception. It was a choice, a pattern, a quiet revolution of empathy. The image of prehistoric life as a relentless struggle where only the strongest survived has long been painted in harsh strokes. But what happens when we find the skeleton of a man who had lost nearly all use of his legs, whose lower body was crippled beyond function, and yet whose bones show signs of advanced age, strong upper body development, and evidence of a life lived in participation with others? What do we make of a child with hydrocephalus who survived well beyond infancy, requiring daily care and attention? These are not isolated discoveries. They appear across continents, across eras, in caves, burial grounds, ancient settlements. Again and again, the evidence suggests that prehistoric groups didn't always leave their vulnerable behind. Sometimes they carried them. But this was not just pity, it was strategy. A community that learns to care becomes stronger. A person unable to hunt might still remember paths, patterns of animal behavior, plant locations, or serve as a watcher during sleep. A disabled elder might become the keeper of stories, warnings, wisdom, the intangible glue that binds generations. When survival was fragile, memory was everything, and memory often lived in the bodies of those who had seen the most. In a world with no books, no drawings, no maps, the mind of the elder became the library of the tribe. The logistics of this care are staggering. To help someone survive a shattered spine or paralyzed limb without antibiotics, without surgical tools, meant more than leaving a few berries near their bedding. It meant changing the rhythms of movement, adjusting pace, guarding someone through long nights, sharing already scarce food. And yet, time and time again, that's what the archaeological record shows. Joints that had adapted to being carried, shoulders that compensated for useless legs, teeth ground down by years of soft food and careful chewing. Healing that could only happen when the body was still, fed, and sheltered. Why did they do it? There is no clear answer. Perhaps the line between self and other was thinner then. Perhaps the idea of usefulness was broader. Perhaps there was an understanding, instinctive or learned, that helping one meant helping all. Because what happens when the hunter becomes the injured, when the strongest needs rest? The moment of weakness touches everyone eventually. In a society that builds a pattern of care, of support, of delayed judgment, is one that prepares for its own continuity. And this care wasn't just physical. The burials themselves tell part of the story. In some graves, individuals with severe disabilities were buried with tools, with pigments, with ceremonial items, suggesting they weren't just tolerated, but honored. One man with a twisted spine was found in a carefully prepared grave, painted with red ochre, and surrounded by tools he could no longer have used. This was not a practical goodbye. It was symbolic, emotional, a final act of recognition. Even more surprising are the signs of touch, bones with careful wear patterns that suggest wrapping, support, and positioning. The physical acts of daily care, not just once, but over years. The same hand lifting, feeding, adjusting, covering. A long, sustained choreography of compassion performed by people who had no written language, no medical training, and no reason to do it beyond the undeniable pull of connection. Modern medicine often defines health as the absence of disease. But in the ancient world, survival wasn't just about avoiding harm. It was about enduring it together. And the proof of that isn't in what was said or believed. It's in what was done. In the healed bones, the preserved shelters, the long lives of those who by all accounts should not have made it. In these quiet, powerful moments of support, we see the roots of something deeply human, the refusal to abandon, the insistence on inclusion, the fierce, inexplicable desire to care for one another. In a world ruled by tooth and claw, caring was a rebellion, and it shaped us more than we know. The idea of cutting into the human skull with a sharp stone and no anesthesia sounds more like a horror story than medicine. And yet, buried deep within the bones of our ancestors is evidence that some of the earliest humans performed precisely that: cranial surgery, known today as trepanation. Long before the invention of scalpels, antiseptics, or even language as we understand it, someone took a flint tool, made an incision in the scalp, and scraped, drilled, or carved a hole into the skull of a living human being, often more than once. It wasn't an accident. It wasn't a brutal act of violence. It was something more unsettling. It was deliberate, purposeful, and in many cases, it was survived. The first time archaeologists found such a skull, with a smooth-edged hole and signs of bone regrowth, they didn't want to believe it. It seemed impossible. But then there was another, and another. From the high Andes to Neolithic Europe, from the African savannas to the steppes of Central Asia, the pattern repeated. Skulls with circular or oval holes, edges healed, bones smoothed over. Not just evidence of trauma, but of treatment and of recovery. The sheer number of these findings suggests it wasn't a rare ritual or a failed experiment. It was a practice, a strange, dangerous, and remarkably widespread attempt to heal. But heal what, exactly? The motivations behind prehistoric trepanation are still debated. Some believe it was used to relieve physical pressure, after a head injury, for example, to drain fluid or blood, easing swelling that might otherwise cause seizures or unconsciousness. Others argue that it had less to do with trauma and more to do with beliefs, that pain, madness, or sickness entered the body through invisible forces and could be released through an opening in the skull. For some cultures, especially those deeply rooted in spiritual cosmologies, the head wasn't just the seat of thought, it was the gateway between worlds. To open it was to free the spirit, to invite healing, to cast out what didn't belong. And then there's the question no one can avoid. How did anyone survive this? The human skull is thick, sensitive, and surrounded by vital tissue. There were no antibiotics, no sterile fields, no painkillers except perhaps alcohol, herbal sedatives, or the numbing cold of wind and snow. The tools were bone, flint, obsidian. Sharp, yes, but crude by today's standards. And yet the bones tell us it worked. In some cases, multiple trepanations were performed on the same individual over years. The bone regrew. The person lived. How? Perhaps because early humans were more skilled than we think. The people who performed these operations likely weren't randomly chosen. They may have learned through experience, watching what worked on animals, practicing on the dead, slowly mastering the art of cutting without piercing too deep. They may have known to boil tools, to wash hands in river water with antibacterial plants, to use smoke to reduce infection. Not all patients survived, of course. Some skulls show incomplete healing or signs of fatal complications. But many didn't just live. They lived long enough for the skull to fully regenerate. That kind of survival doesn't happen by luck. It happens through care, through precision, through trust. And there is another layer, ritual. Many trepanned skulls show no signs of head injury, no fracture, no bleeding inside the skull prior to the operation. That suggests the procedure wasn't always performed to save a life. It may have been done to save a soul. Mental disturbances, seizures, extreme emotional behavior, all of which we now understand in neurological or psychological terms, might have been seen as signs of possession, curses, or imbalance. A hole in the head became not just a wound, but a portal, a way to let the unseen escape, a physical solution to a spiritual crisis. In this sense, The earliest surgeons were also spiritual leaders, intermediaries between body and mystery. They cut not just with blades, but with belief. And the patient, terrified, suffering, desperate, allowed it. Whether from hope, submission, or ritual obligation, the human being at the center of this procedure had to lie still while sharp stone entered bone. And when they woke up, if they woke up, they were different. Perhaps healed, perhaps broken, but always changed. It's easy to look back at this and call it barbaric, but that's too simple. Trepanation, as strange and unsettling as it seems, reveals something deeply human, a refusal to surrender to suffering, a desire to act, to intervene, to try. When someone convulsed, when someone screamed through the night, when someone collapsed after a blow to the head, our ancestors didn't always just watch. They did something, risked something, cut through bone to chase the hope of healing. And isn't that the core of medicine even now? The blend of fear and knowledge, of trial and belief, of pain and possibility. They didn't know about neurons or antisepsis, but they knew the weight of suffering, and they dared to open it. When pain had no explanation, it had to have meaning. In the absence of microscopes and diagnosis, of theories and labs, early humans turned to the only framework they had to interpret the inexplicable: belief. Pain wasn't random, it was a message. Illness wasn't internal, it was an invasion. Something had been broken, crossed, angered. The body didn't just suffer, it reacted to a curse, to a spirit, to a punishment for a rule not even the sick person knew they had broken. And so healing could not be found only in bark and herbs, but in symbols, gestures, smoke, and sound. It required someone who could read the unseen, someone who could speak the language of mystery. The earliest doctors were not scientists, they were shamans. These figures, often marked by physical difference or emotional sensitivity, walked a line between worlds. They didn't just treat the sick, they journeyed in trance or ritual to confront the invisible source of the sickness. A sudden fever wasn't just the body overheating, it was the fire of an angry ancestor. A seizure wasn't a neurological storm, it was possession. A deep wound that refused to close was a sign that something had entered the blood that didn't belong. And so the healer prepared, with chants, with smoke, with offerings, with rattles made of bone, with carvings on stone, with markings painted in ochre on the skin of the sick. The process of healing became performance, not in the sense of deception, but in power, in transformation. The sick person was not treated in isolation. They were surrounded by watchers, by family, by the community. The ritual became a shared experience, a collective act of confrontation with what they could not see. The tools were simple: feathers, stones, fire, water. But their power was drawn not from their chemistry, but from belief. And belief, anchored in repetition, emotion, and fear, was a potent medicine. There were rules. Certain illnesses were thought to be the result of broken taboos: eating the wrong animal, entering the wrong place, touching the wrong object. Others were blamed on contact with outsiders or on the lingering presence of the dead. These frameworks weren't arbitrary. They gave structure to chaos. They made pain make sense, and through that meaning, they created a way forward. If the spirit was angry, it could be calmed. If the curse had a source, it could be undone. If the balance had been broken, it could be restored. The healer didn't promise a cure. They offered a path. And within this world of symbolism and shadows, one truth always lingered just beneath the surface. The smallest bodies carried the greatest fragility. Children, especially the very young, were often the first to fall sick and the least likely to survive. The archaeological record is filled with their tiny bones, buried close to settlements, wrapped in care and pigment, their lives cut short by forces too swift, too silent to be stopped. A cough, a fever, a sudden stillness. In the ancient world, these moments happened over and over again, often without warning, without explanation, and without anything to stop them. In many communities, infant mortality wasn't a tragic anomaly. It was a brutal constant. For every birth, the odds leaned heavily toward loss. Diarrhea, respiratory infections, weakness, accidents, all of them could claim a child within days. And yet, the effort poured into their care reveals something profound. Cradles were shaped, swaddles were woven, names were whispered, tiny beads and charms were strung around wrists to protect them from spirits. Mothers chewed food to feed them. Fathers carved toys and tools scaled to miniature hands. In a world that knew the risk of every new life, they still chose to invest in it, again and again. And when a child survived, when they passed that unseen threshold of vulnerability and grew into a walking, speaking member of the group, it was not just biology, it was a miracle. The celebration was not only joy, but relief. This one made it. This one crossed the line. This one could carry memory, carry fire, carry the future. And from that child came the stories, the work, the hunt, the laughter. From that child came continuation. But what happened when that child fell ill? Everything stopped. The group's pace shifted. Herbs were gathered, prayers were spoken, stones were heated and laid near small feet, hands pressed against foreheads, eyes watched every breath. If they couldn't explain the illness, they could at least bear witness to it. They could hold, they could sing, they could offer their belief in the form of action. The smallest body became the center of the world, and sometimes, against all odds, the child recovered. Fever broke, cry returned, color came back to the lips. In those moments, the entire worldview was affirmed. The ritual had worked, the spirit had passed, the child had chosen to stay. And the community, breathing again as one, returned to life, scarred but intact. Behind the myths and the mysticism, behind the painted faces of healers and the solemn chants around the sick, lay something far simpler and more universal. Love. A parent's desperation, a community's hope. The unbearable silence of watching someone too small to explain their pain. These were not ignorant people fumbling in darkness. They were humans staring into the abyss of suffering and refusing to turn away. In every whispered chant and carefully chosen herb, in every symbolic cut or protective charm, was the same ancient desire that pulses through us still, to understand pain, to push it away, and to save what we love, no matter the cost. There was no clean room, no soft light, no midwife with instruments laid out neatly on a sterile table, no backup plan. When labor began, it began where life happened, under trees, beside fires, in the back corners of caves. And it came with no guarantees, a cry, a scream, a body writhing against the dirt, and around her a handful of hands, perhaps experienced, perhaps not, trying to help her bring forth life in a world where every breath was a gamble. For prehistoric women, the act of giving birth was not just a passage, It was a confrontation with danger. The female body, revered and relied upon, was also a battleground where survival, biology, and pain collided in the most intimate and irreversible way. Pregnancy was not a private experience. It changed how a woman moved, what she could eat, how she slept. It demanded adjustments from the group: less travel, more food, fewer risks. But that adjustment was not simply compassion, it was preservation. Every unborn child was a future hunter, gatherer, protector, memory keeper. Every pregnant woman was not just carrying a baby, she was carrying the future of the tribe. That meant her body, in all its vulnerability, became both the most sacred and the most at-risk vessel in the community. But what did it mean to carry life when there was no concept of prenatal care, no understanding of infections, no antiseptics, no emergency procedures? It meant that the body had to do what it had always done: navigate the treacherous line between creation and collapse. A narrow pelvis, a twisted fetus, an umbilical cord wrapped at the wrong angle, any of these could be fatal. Blood loss during delivery was common. Internal tearing went untreated. Infection crept in unseen. And yet, despite this, birth continued, again and again. Not without tragedy, but not without triumph either. Evidence from burial sites reveals women who died in the final stages of labor, buried with stillborn children or infants who lived only briefly. Their remains tell a story of struggle etched into the bones: pelvic deformities, healed fractures, signs of nutritional stress. But others show something different: women who gave birth not once, but multiple times. Pelvises shaped by repeated deliveries. Teeth worn down from a lifetime of feeding others. Bones strong and wide, shaped by the hormonal tides of childbirth and breastfeeding. These women survived. They endured, and they were likely among the most respected members of their groups. It wasn't just biology that determined survival. It was knowledge, passed through touch, through observation, through whispered memory. Certain postures helped labor. Certain herbs soothed contractions or encouraged milk. Certain hands knew how to turn a baby, when to press, when to wait, when to cut the umbilical cord with a shard of obsidian. There were no textbooks. There were bodies, experiences, blood, and instinct. The first midwives may not have had names, but they had presence. And in the moments that defined the line between life and loss, that presence was everything. Women in early societies were not simply passive vessels. They were central figures. They gathered food, created tools, prepared medicine, remembered traditions, and in times of birth, they became the axis around which the entire group tilted. The success of a pregnancy, the health of a newborn, the strength of a mother, these were not private matters. They affected everyone, because if the mother didn't survive, the child might not either. And if the child didn't survive, the group lost more than a body. They lost continuity. In this way, every birth was a communal event, a high-stakes gamble watched by many, felt by all. But it wasn't just childbirth that placed women in danger. Their lives were punctuated by cycles: bleeding, ovulation, pain, hormonal shifts, each of which was not fully understood, but certainly observed. Menstruation, in many groups, became taboo or sacred. In some places, women were isolated during their bleeding. In others, they were revered as vessels of power. These responses, though different, pointed to the same reality. The female body was unpredictable, powerful, and deeply mysterious. And like all things not fully grasped, it was both feared and revered. What emerges from this long, painful, and profound history is not a picture of weakness, but of immense strength. To carry life in a world without safety nets, to bleed and heal without intervention, to endure cycles of pain and still rise to forage, teach, nurture, fight. It demanded more than resilience. It demanded presence, a kind of courage that didn't come from dominance, but from the sheer necessity of staying alive for others. And perhaps that's the greatest truth hidden in the bones, in the dirt, in the rhythm of those early days. That the survival of the tribe was not just about who hunted, or who fought, or who built shelter, but about who bled, who gave, who brought new life through pain, and then stood up the next morning to carry it forward. In the story of prehistoric survival, women were never on the margins. They were the heartbeat, the first to risk, the first to suffer, and often the first to keep going. There comes a moment in every human life when the body begins to falter, when legs no longer move with the same speed, when fingers tremble instead of gripping tightly, when eyes struggle to distinguish shape from shadow. In the prehistoric world, where survival depended so much on strength, endurance, and quick reaction, it would seem logical that such a moment marked the end. A person who could no longer hunt, climb, carry, or defend might appear at first glance to be a burden. But the bones and the patterns of settlement tell a different story, one that quietly, yet powerfully, shifts our understanding of what early humans valued. Because when the body could no longer chase animals or dig roots, the mind often stepped forward to offer something even more vital: memory. Archaeological sites across the globe have uncovered remains of individuals who lived long past their physical prime, people with spinal deformities, fused joints, missing limbs, or advanced arthritis. These individuals could not have contributed physically to the daily grind of prehistoric life. They would have needed help moving, eating, perhaps even relieving themselves. And yet, they weren't abandoned. They weren't left behind. In many cases, they lived for years in their conditions, years that would have required deliberate, continuous care from those around them. This simple fact, over and over again, reveals something fundamental. Usefulness was not measured only in muscle. Wisdom, presence, memory, these too were survival tools. When you've lived through countless seasons, watched rivers rise and fall, seen animals migrate and return, learned which plants heal and which poison, you carry something that no strong back or sharp spear can replace: understanding. And in a world without writing, every lesson had to live in someone. The elder who could no longer hunt might remember where the deer crossed last winter. The woman whose hands trembled might still recognize a healing root by its smell. The man who sat by the fire while others climbed the hills might know stories that warned of flood, fire, betrayal, or reminded a people who they were. These people became anchors, not because they worked, but because they remembered. They were not extra mouths to feed. They were libraries, walking repositories of pattern, instinct, tradition. Around the fire at night, while others rested bruised bodies and sore feet, the voices of the elders would rise, not in lectures, but in stories, tales shaped by rhythm, repetition, symbol. Stories that passed down hunting strategies, disguised as myths or social rules masked as warnings. Through them, children learned not just how to survive, but why to survive, what to fear, what to hope for, who they were, and perhaps more important than even the stories were the relationships. The presence of someone who had seen more, endured more, and still remained offered something beyond information. It offered continuity, a sense that life stretched beyond the moment's hunger or wound, that there was a thread tying one generation to the next, not through blood alone, but through memory, trust, and transmission. There's evidence that these elders participated in rituals, served as spiritual guides, or oversaw key communal decisions. When a group faced famine, relocation, or conflict, those who had seen such trials before were turned to not for strength, but for judgment. And that judgment, shaped by long experience, often meant the difference between disaster and adaptation. Even in practical terms, older individuals contributed. They helped care for children, guided the ill, prepared herbs, watched over the weak. In a society where every pair of hands mattered, so did every pair of eyes, especially the ones that had seen the most. They didn't compete, they advised, and in their stillness, they observed what others missed. The concept of retirement didn't exist. There was no line between work and wisdom. There was simply life and the roles it asked of you as your body changed. To be old in the ancient world was to be rare, and rarity has always carried weight. Of course, not every community acted with compassion. There were likely times, during famine or flight, when difficult choices were made. But the overwhelming archaeological picture is not one of ruthless efficiency. It's one of surprising humanity. The fragile were protected. The aged were buried with care, often with tools and ornaments that hinted at their importance. They were not cast off. They were honored. And in that choice, over and over again, we see the roots of something far more modern than we might expect. The idea that identity isn't defined only by what we can do, but by what we know, who we are, and what we pass on. In the quiet eyes of an elder sitting beside the fire, there flickered not just memories of the past, but the blueprint for the future. A future in which being human meant more than surviving. It meant remembering, teaching, and being remembered. Among the most haunting and humbling archaeological discoveries are not the weapons of prehistoric war, the towering bones of mammoths, or even the ancient cave paintings etched in flickering ochre. They are the fragile, twisted, incomplete skeletons, silent evidence that someone long ago once lived in a body that didn't function normally, yet survived. These are the remains of people who walked with uneven gaits, or not at all, people who had lost limbs, whose spines curved unnaturally, whose joints fused or crumbled, whose bodies defied the brutal expectations of a world where every step, every climb, every reach mattered. And yet, they did more than survive. They lived long, full lives. They aged. They mattered. And in doing so, they challenge everything we once assumed about what life in the Stone Age was like. In one remarkable case, scientists unearthed the skeleton of a young person in Southeast Asia who had undergone a lower leg amputation some 40,000 years ago. Not a crushing accident, a clean, intentional removal of the limb. And what shocked researchers wasn't just the operation itself, it was the evidence of survival. The bone had healed. The individual lived for years after the procedure, adapting to a world with one leg, unable to walk or hunt in the traditional sense, relying instead on the community around them for support, protection, and care. In a time with no steel tools, no antibiotics, no formal medical knowledge, the fact that such a procedure was performed and that the patient not only recovered but continued living suggests a society far more cooperative and sophisticated than we once believed. Elsewhere, in Europe, the remains of a man with severe scoliosis were found in a ceremonial burial site. His spine was curved so dramatically that it would have affected his mobility and ability to perform most physical tasks. And yet, he was buried with symbolic objects, wrapped in careful layers, laid to rest as someone valued. His deformity wasn't hidden or discarded, it was honored. In Central Asia, archaeologists uncovered the body of a woman with missing fingers and fused knees. Her body told a clear story of suffering, but the soil around her was rich with tokens, artifacts, signs of offerings. She had been remembered, cherished. Her disability hadn't excluded her from ritual. It had become part of her identity, and her group had affirmed that identity, even in death. There are remains of individuals with crushed skulls who lived long enough for bone to regrow, suggesting both survival and likely rehabilitation. Others show signs of withered limbs from polio or infection. Still others have congenital deformities that would have been obvious from early childhood. None of these people would have been able to contribute fully to the physical demands of daily life. And yet their bones show signs of wear that come only with age. They weren't discarded, they were integrated. This stands in stark contrast to the old narrative that the ancient world was a place where only the strong survived, where nature was merciless and humans were little more than instinct-driven creatures clawing for survival. Instead, we find a different picture emerging, one of empathy, ingenuity, and community. A society that recognizes worth not just in what a body can do, but in what a person can be. Injuries that today would be managed with prosthetics or therapy were thousands of years ago navigated through creativity and collective effort. A person missing a hand might learn to use tools differently. Someone who could not walk might have been carried or given tasks they could do seated. And the act of carrying wasn't just physical, it was cultural. It was a decision. This person stays. This person matters. The emotional weight of these discoveries is immense. They suggest that long before we had ethics or codes or formal systems of welfare, we had something even more primal: connection. We had the capacity to look at someone in pain, someone broken, and decide, not them alone, us together. And perhaps that this is the most human thing of all, not our tools, not our language, but our refusal to let each other vanish into silence, our insistence that even in a broken body, there is a place, a role, a future. The prehistoric world was undoubtedly harsh, but it was not heartless. The bones we find tell stories not just of suffering, but of solidarity. They whisper that disability did not mean the end. It meant a different beginning, a reshaped life, a reimagined role, and a society that, however ancient, had already discovered the truth we still struggle to live by, that the measure of humanity is not strength, but how we treat the vulnerable. And by that measure, perhaps our distant ancestors were more evolved than we ever imagined. Somewhere between the scraped knee and the shattered bone, between the fever that lingered and the wound that festered, Humanity was quietly born, not in triumph, but in response to suffering. Long before laws were written or temples were raised, there was a moment when someone chose to stay behind with the injured, when a hand reached out not to take, but to soothe, when food was shared with someone who could no longer gather it, when effort was given not for survival of the fittest, but for survival of the connected. In that moment, something changed. Pain became not just a signal of weakness, but a spark for togetherness. And in that spark, culture began. The choice to care for the sick, especially when it made no immediate benefit to the group, marked a seismic shift in the story of us. It meant we recognized others not only as bodies, but as beings. It meant we saw beyond usefulness, beyond speed or strength, and into something deeper, shared existence. The man with the broken leg, the woman bent by childbirth, the child with a persistent cough, each represented a challenge not just of biology, but of community. And each time they were fed, carried, healed, or simply held, humanity reaffirmed itself, not as a species of dominance, but of compassion. This care required memory, observation, intention. It wasn't accidental, it was learned, taught, remembered. The root that helped with fever, the poultice that soothed swelling, the ritual that brought calm to the distressed. These weren't just practical tricks. They were the first libraries, held in minds, passed in gestures, whispered in night stories. Through them, generations connected. Through them, knowledge flowed, not through books or screens, but through hands and hearts. Illness created bonds because it exposed need. It pulled us inward, made us slower, more vulnerable, more honest. It stripped away the pretense of independence. And those who stood beside the sick, those who stayed when it was easier to leave, became the first teachers of empathy. They didn't just help the body heal, they helped the group cohere. Every act of care reinforced belonging. Every recovery was not just individual, it was collective. And as time passed, this caring took form. It evolved into ritual, into belief, into structure. The healer's touch became sacred. The fire around which the sick were warmed became a place of storytelling. The herbs passed hand to hand became a symbol of trust. And so medicine and meaning walked side by side. Pain didn't just need treatment, it needed explanation. And from those explanations came myth, morality, and ultimately society. Even now, in our world of pills and scans, of data and diagnosis, we remain tethered to these early instincts. We still sit by hospital beds, not only because we must, but because we can't imagine not doing so. We still light candles, say prayers, or reach for lucky charms when someone we love is hurting, not because we think they'll cure, but because they connect us to the ancient belief that intention itself matters, that to witness pain is to participate in its transformation. We still fear pain, not just the sensation, but the isolation it brings. And so we surround it with care. We build systems around it. We wrap it in story. We seek meaning in it. We name it. We map it. We make art from it. Because pain, perhaps more than any other human experience, demands interpretation. It makes us ask, again and again, why? And every attempt to answer that question, whether through a scientist's theory or a shaman's chant, is an echo of the first fireside murmur. Stay with me, help me, don't go. We've carried more than tools through time. We've carried gestures, a hand on a fevered brow, a shared sip of water, a rhythm of breath aligned with another's in sleep. These are not artifacts in museums. They live in every hospital room, in every whispered comfort, in every child soothed by a lullaby. Even our modern rituals of healing, therapy, medication, surgery are rooted in that first, primal impulse to help. And though we now wear gloves and speak in diagnostics, the core remains unchanged. Someone hurts, someone helps. In that simple exchange, we meet ourselves, not as lone survivors, but as threads in something vast and interwoven. Disease did not just challenge us, it revealed us. It carved space for empathy to grow. It taught us that being human is not a state of strength, but a state of response. That what defines us is not how we avoid suffering, but how we meet it. In ourselves, in others. And as long as we live, we will carry this inheritance, not just in blood, but in behavior, not just in medicine, but in meaning. Because the oldest story we tell, the one that began in a cave with a cough and a circle of watchful eyes, is still the one we live. A story of pain, a story of hope, a story of hands reaching out again and again, saying, "You are not alone."